We recommended 3 readings, and you'll see them displayed here. They're fact sheets put out by the National Collaborating Centre for Aboriginal Health, and they were authored by Dr. Loppie and her colleagues. And, of course, they're available on the NCCIH website, all downloadable, all free of charge. So please, if you didn't get a chance to read these ahead of time, please go ahead and read them when you can. I think they are extraordinarily informative and very helpful as we think about our practice and working with Indigenous people. This slide shows a new publication that has just come out. It actually came out in about August of 2015, and if you're wanting to learn more about the determinants of Indigenous people's health in Canada, this book is available through the Canadian Scholars Press. It was written by Dr. Sarah DeLeo and Dr. Charlotte Redding, myself, and Nicole Lindsay, and it features all sorts of articles and poetry and narrative from First Nations, Inuit, and Métis scholars and activists, clinicians, and community leaders. I think it's really important to note here, too, that all of the proceedings, royalties from this book are going to the First Nations Child and Family Caring Society of Canada. Cindy's really happy about that. Let's hope it sells lots. This slide in front of you now shows the National Collaborating Centre of Aboriginal Health as one of 6 NCCs that were established in 2005, and we are funded by the Public Health Agency of Canada. Our sister NCCs are focused on different topic areas, including infectious diseases, environmental health, healthy public policy, the determinants of health, and methods and tools for knowledge translation. Our center is quite unique among the 6 in that we are the only center to be focused on a particular population. The Collaborating Center, our goal is to support health equity and has been for the last decade for First Nations, Inuit, and Métis people by promoting the use of Indigenous-informed evidence to transform practice, policy, program, and decision-making across all sectors. I think one of the things that has been really important in the work of the Collaborating Center is to bringing forward people's voices and creating those platforms for people to speak for themselves, to describe their own realities and their own health needs and solutions to those needs. We focus in 4 particular areas: social determinants of health or determinants of health in Indigenous people, child, youth, and family health, emerging priorities, and Indigenous knowledge and knowledge translation. So you can see that our mandate is extraordinarily broad, and we can work on just about anything we need to. Now to the business of the webinar. I am very pleased and it gives me great pleasure to introduce Dr. Charlotte Loppie. And there's that extraordinarily beautiful picture of Charlotte there. She is a professor in the School of Public Health and Social Policy at the Faculty of Human and Social Development at the University of Victoria. Charlotte is the director of the Centre for Aboriginal Health Research and editor of the International Journal of Indigenous Health. Charlotte has also been a long-serving member of the National Collaborating Centre for Aboriginal Health National Advisory Committee. Charlotte has undertaken research and published in areas such as Aboriginal health inequities, Aboriginal HIV/AIDS, social determinants of Aboriginal health, racism and cultural safety, cancer among Aboriginal peoples, Aboriginal ethics and research capacity building, as well as the sexual and reproductive health of Aboriginal women. Charlotte, we welcome you and thank you for joining us today, and thank you now for sharing all your knowledge that I know others will find extraordinary in listening to you this morning.